we are in conversation with Dr. Amna. We're talking to her at length about laparoscopic surgery and minimal invasive surgeries. Now, doctor, so there's this notion, right? When you're talking about laparoscopic surgeries, maybe it won't fit the old, or it won't be much suited to younger children. Is this a myth or is this reality?
No, it's an absolutely myth. It can be done even from a neonate, which is a newborn, to a person who is even 90 or 95, depending on if they have any comorbidity in terms of giving an anesthesia to them. Because if we talk about children or newborn, there are certain disorders or there are certain diseases which are congenital, or once they are immediately it's being picked up when they are born, or they are picked up when the female is pregnant and they are being counseled to deliver at a facility where pediatric or a neonatal surgeon is available, and they can be immediately taken up for surgery. Lot of times they have we have a food pipe called an esophagus, and in few children it is not being formed properly, so we call it esophageal atresia. So if we don't treat it immediately, definitely a baby cannot feed. They keep on vomiting, they keep on throwing up, and then they keep on regurgitating the same fluid into their lungs. And if not treated adequately or early, they can die off because of any lung problem. So these are the babies which we need to take up immediately on day 1 or day 2 of the birth, and people are doing it through thoracoscope, like a scope in the chest wall, and repairing it. So it's quite safe, and only the thing is that it needs to be done in a particular setup where post-operative care is available. Same goes for people who are old age. Like we have done surgery of weight loss through a camera or a keyhole for even males who are 78 or 80, and they did have a comorbidity of diabetes, and it was controlled, and we did go ahead. Definitely they need to get clearance from the cardiologist, from anesthetist, but if everything is under control, we can go ahead with the laparoscopic surgery. And second thing is, a lot of people think that if it's a long surgery, it's safe to do it via open method rather than doing a camera procedure. So it's not true. And especially you were talking about kids, so kids have to live with that scar which for lifelong, which is not good. So for everyone the cosmesis is important, but it's very important for a kid, because if we give a scar on the belly of a kid, when the baby has to grow, and that scar also grows with the baby, it goes from the belly to the chest. Similarly, if we give a chest incision, it may go up higher to the upper chest or the neck level. So in babies especially, the scars are very disfigured, and as the baby grows, the scar become big and thick. So we should be careful that as much minimally invasive procedure or techniques can be undertaken for kids should be there, and same goes for adult or even old people, because even old people, no one would like to see their body having big ugly or disfigured scars. So it is easily being done for even longer procedure or for even doing shorter procedure. So anesthesia is again something which has evolved a lot during few years, and it's very safe. So when we talk of whether छोटी surgery है तो ठीक है, laparoscope या कैमरा वाली है, या और लंबी सर्जरी है, so better to go for an open ताकि जल्दी हो जाए, anesthesia कम हो. So this all is wrong concept, because once you are under anesthesia, you are safely under anesthesia, and it's a duty of an anesthetist to wipe off the anesthesia medicine from your body, and you are safe. So anesthesia is as safe as surgery these days. So don't just restrict or refrain yourself from laparoscopic surgery.
Right, and moving forward, the notion that robotics, anybody can do it. Does it require some serious sort of, a study to go behind it? Do doctors need to undergo some sort of a training? How does this really work?
एक और डिग्री डॉक्टर को मिल ऑलरेडी उन्होंने कर लिया है, 5 साल 6 साल का मेहनत है.
Yeah, yes, definitely we need a special training for doing a robotic surgery. And having a robot in the hospital, not every hospital has it. But yes, there are a lot of hospitals which are having a robot, and the surgeons are being trained. So people who are already into play with the laparoscopic surgeries, it's not quite difficult to operate the robot. So robot does the same function what a surgeon does. Only the surgeon has to operate. So they have to feed data and then how the robot works. So it's not like a kind of 4-year 5-year training. You just need a bit of training of how to operate the robot, and then you can go about it. It's not a long training.
Right. And now robotic surgery does not allow the surgeon to feel the internal organs, and therefore clearance of cancer is not as good. I'm talking about this in correlation to cancer. And this is a myth as well.
Okay. So, for a cancer surgery, actually, you don't just go directly and operate. First thing is that a surgeon does a biopsy, which will not be a robotic thing generally. Once a biopsy proves a cancer, you have to stage the disease. So you will not directly go for a surgery. Nowadays, it is not like surgeon will go and feel an intestine, for example, if it's a colon cancer, and wherever he feels he's going to remove that part. No, we have to stage by doing a proper biopsy. Then we do a CT or an MRI to stage the disease. So a surgeon will not see something which is inside the lung. A surgeon cannot even feel that. So it is not that surgeon has to go and feel something. We stage the disease, we plan the surgery before performing the surgery. And if, for instance, if there is a left-sided colonic tumor, so there is a guideline of how much to cut and remove and where to join the normal or healthy intestine. For that, a surgeon does not have to go and feel inside. Yes, in case a surgeon has to do inside study of a colon, then he will not do a robotic surgery. He will take a help or an assistant of a gastroenterologist who will come put a scope from the rectum or the area we pass tool, and he can visualize internal area of the colon and gives us the information. And for the external area, we don't have to formally go and feel. CT, MRI, a lot of investigations are there, and proposed methods and proposed surgeries are already there. So surgeon don't have to feel or change or amend anything.
And also weight के हिसाब से कहते हैं कि you have to be the perfect weight. अगर आप underweight हो, overweight हो, तो laparoscopy is not for you. Is it a myth?
It's again a wrong concept, because even for as fat as you are, laparoscopy is even better than an open surgery, because you will have a surgeon have a better access and a better visualization in a laparoscope. So we have different length of instruments, we have different length of scopes, and it is good from a very thin or an underweight patient to an obese patient. Like we do a lot of weight loss surgeries also, and we operate like patients who are 200 to 50 kgs also. And we always believe that laparoscope or a keyhole surgery will be our first priority, because first thing, it's a good access. Second thing, it's a better visualization for us. Third thing is that a better patient cosmesis. So it's again a myth that we cannot operate fat people or underweight people. Another thing which people believe is that if it's a redo surgery, or they have undergone one procedure and they are coming for a second procedure, or they have had a failed procedure and then they are again coming for a second procedure to be successful, we cannot do laparoscope. No, it's not true. Generally we see patients with hernias who have done, for instance, one side hernia and they are coming for another side hernia, or another area, but we have to deal or go inside the abdominal cavity again. For instance, a lot of females believe they have done a cesarean for a childbirth and now they have got a hernia, so we cannot do a laparoscopic surgery. No, that's wrong. Especially with the laparoscope, we can go and see all around in a better way. Also, open surgery is like a surgeon makes a cut where the surgery has to be done. For example, in a hernia, a surgeon will make a cut which is restricted to that area. He will go inside, operate and come out. While if we are doing a laparoscopic surgery, if you take a simple example of an inguinal hernia, and it's equally applicable in pediatric or children, that if they are diagnosed with one side of inguinal hernia, if we do an open surgery, we will only give a cut on that particular side, repair the hernia and come out. Lot of times baby has hernia on the other side also. If with an open surgery we cannot see the other side, but if we are putting in a scope and performing a laparoscopic surgery, we can visualize both sides, and we can repair both sides, and we can get away with one surgery rather than multiple. Same happens for an adult patient. If someone has a hernia at a belly button picked up on the scan and they came for a surgery, lot of time we go inside with the laparoscope and we see, oh, there is a small defect on the left side of the midline or the right side, and we can repair it at the same time. If we do an open surgery, we'll only go to that area which is our focus, cut, go inside, repair it and come out. So it's rather advantageous to go for a laparoscopic surgery rather than an open surgery in very many ways.
Right. And moving forward, where women are with fibroids or large ovarian cyst, and they cannot have a surgery due to its small incision. What's your take on it?
No, they can always have a keyhole or a laparoscopic surgery. In fact, at our hospital, our gynecologists are working on it, and they don't do open surgery. A lot of females who are coming with ovarian cyst and all these fibroids. So fibroid is basically a growth which is there in the uterus. So multiple fibroids, even they can be removed via keyhole surgery, and so the same goes for the ovarian cyst. You don't have to undergo an open surgery for either of these diseases.
And how safe is it?
It's very safe. It's very safe because surgeon is doing the same procedure. The only difference is that they are giving a small cut on your body. Anesthesia, as I said, is very safe. Whether you take an anesthesia for an hour or you take it for 3 hours, it's very safe. And then again, surgeons who are doing day and night laparoscopic surgeries, like our gynec department is quite busy in doing a laparoscopic surgeries, and so they don't take much time also, in terms of if someone is scared that it will be a longer surgery or a shorter surgery. At the end of the day, from a doctor's point of view, it should be a safe surgery rather than calculating whether it's going to take 1 hour or it's going to take 1.5 hours. Like if someone asks me, I would rather go for small cuts and get a surgery done for half an hour extra than going for an open big cut which is going to stay lifelong with me as a scar.
सुपर काफी डिस्कशंस हमने की. अगर आपको और जानना है तो imh.e पे आप लॉग ऑन कर सकते हैं. एंड ऑल्सो क्विकली टू समराइज, इसके क्या एडवांटेजेस है लैप्रोस्कोपी सर्जरी के? जैसे कि मल्टीपल टाइनी कट्स आप करते हो तो पेन जो है वो काफी कम होगा. ऑल्सो बेटर कॉस्मेटिक रिजल्ट है आफ्टर लैप्रोस्कोपी सर्जरी.
Yes, we didn't talk about one thing which is like notes, natural orifice surgery. So nowadays people are also doing a single hole surgery which they do through a natural orifice. For general surgeons to easy to understand, people are giving cuts in the belly button itself. So that is not even multiple cuts, and they go inside and they do some basic procedures like appendix, gallbladder. So even it is one step ahead of keyhole surgery. We do this, it is like one port which has multiple openings, and we put a camera and instruments through the same port. So patients after the surgery, when they wake up, they don't see any scar on their body, and that is called a scarless surgery. Lot of people are doing it for thyroid diseases also. They go from oral cavity and then they remove the thyroid for multiple reasons. So that is called natural orifice surgery, in terms that they don't give any cut on any part of the body. Coming back to the laparoscopic surgery, it is very safe. It generally takes same time or even less than what a surgeon will take while doing an open surgery. Another advantage is they can see the area of interest and the surrounding area, and the surgeon who is performing and people around them can see, it's a better or a magnified field. They can see it all over, and at the end for the patient it's almost a scarless surgery, and the cuts are very small. It's a quick recovery. Going back to work, going back home, everything is quicker than a general an open surgery.
Superb. Dr. Amna, thank you very much for being in our studio. अगर आपको और डॉक्टर आमना से अपॉइंटमेंट बुक करने हैं, द नंबर टू कॉल इज 044063,000 या imh.e पे भी लॉग ऑन कर सकते हैं. थैंक यू सो मच. विल सी यू नेक्स्ट वीक नाउ.
Thank you.
Thank you.